Hey, everybody. Welcome to Meddkit's Provider Spotlight, where every week we are interviewing the most amazing private practices from all over the United States. Every week we have a brand new perspective. We have brand new people that are in all different kinds of specialties that we're interviewing, and it's really exciting. We're getting really good information here that we are here to share with the world. And today I have a really awesome special guest that I want to introduce you to. Today we have Dr. Katrina Wood. She is the owner of Wilshire Valley Therapy Center in Los Angeles. Katrina, we are so happy to have you. Thank you so much for being here.
Oh, good morning. Yes, it's really excellent to be here. And also just to know that you're doing this, nationwide and getting insights from all sort of walks of life into, the healing arts fields and various fields. So I'm excited to tell you, our kind of take on mental health and the trajectory of the future in regarding mental health too, which I think is important. It's such an important field.
I couldn't agree more. And actually, to kind of start us off here, I feel like people really enjoy the origin story. I think people, once they get to know someone, get to know their background, it makes everything else just like that much more interesting. And I would love to hear your story. I would love to hear, what inspired you to open up your own practice.
Wow, it's a bit of a long story. I'm going to kind of sort of try and shorten it as much as I can. I mean, the origins for mental health, what I've noticed is the area that a therapist sort of specializes in is an area that they have known and experienced in their lives, often in ch early childhood, from addiction and recovery for my story, which is a post-traumatic stress disorder. And my father was a POW in a very difficult prison camp in Singapore during World War II, and he was one of the soldiers that built the bridge on the River Kwai and the Burma Railway, which was called the Death Railway at the time. Only a third of the soldiers, and they were from Australia, America, various countries, as well as Britain, survived. So he was fortunate enough to survive. Interesting enough, a little anecdote, my mother, who was dating him when she was 16 at the time in London. The family got a telegram saying missing, presumed dead. So they assume my father had passed away
Oh
from
my
being a
gosh.
prisoner of war. So she got engaged to somebody else. She got engaged to a GI, American GI who was based in London. My father survived the war, was actually freed by the American soldiers at the end of the war in September of 45. It's the 80th anniversary coming up this year. And so he landed in London and knocked on the door of my grandmother's house where my mother was living. And my grandmother opened the door and she, in a typical British sort of way, said, I'll put the kettle on, which is sort of what the English do. They make tea when they don't quite know how to deal with a shock. And my mother was in the back room with her now new fiance. And so my mother came and saw that my father was actually alive. And in that moment, she had to sort of make a decision. And they went for a walk in the bombed area of London because it was completely bombed. And in that moment, she made the decision that she was going to stay with my father. And so they went on and got married. And so he had very severe PTSD to the
Sure.
point from having been incarcerated in that prison camp for 4 years.
First.
And so, I was in that environment, in that milieu, with being on the front line, so to speak, of the symptoms of PTSD, which are very, they're they're hard to explain because they sort of come out of left field. And there are symptoms, obviously, in the diagnostic manual, DSM-5, of hypervigilance, explosive, outbursts, very bad sleep. And so as a child, I was sort of navigating all of this. It was like being in a minefield, really. What are you going to step on? Fortunately, my father became a very well-known British actor and channeled a lot of his trauma into the craft of in the arts, field of the arts, and so became very adept at taking the characters and taking his emotions and putting them, in that field. So in many ways, that was really helpful, and helpful for anyone who has trauma to go into the creative arts or the field where they can channel that. But nevertheless, our family and myself were on the recipient of PTSD. And so I started to explore that. I got into television in England, where I started working at London Weekend Television as a sound engineer, actually, when I
Yeah.
left school. And I worked on a lot of shows. I don't know, in America, there was a show called Upstairs, Downstairs, which was about a show where the British Victorian era, where the wealthy people lived in the top part of the house, and the cooks and the people, the servants, lived in the basement. And so this was called Upstairs, Downstairs, and I worked on that show. And I got, quite qualified and decided, because as a little girl, my father had made a lot of films in America, in LA, of course, Mutiny on the Bounty, Bridge on the River Kwai, which was about the actual prison camp he was in.
Mm.
So I came to California in my very early 20s. I had traveled because I was searching for more. I knew that I couldn't settle being a sound engineer. My whole psyche was sort of geared towards exploration. I'd been raised in a home with Shakespeare and the creative arts, and so we were raised to be curious about a lot and to explore. So I went to India. I lived in India for a year. I lived in Nairobi in Africa for a year. I worked at the Donovan Moore Theatre in Africa. I went out on the game parks. I was always searching. And then I finally landed in LA, where I got a job at CBS on Fairfax and TV City,
Mhm.
again as a sound engineer. But I was still looking for more. And one day, and I think I mentioned this to you,
Mhm.
uh, I was looking for, I don't know what I was looking for, but I remember my analyst at the time said, "You're on a search. Your soul is on a search," he said. And I thought, well, I'll leave it there. Let my soul do the searching. Let that control the situation. I'm not going to kind of get in its way. And I saw this movie, which was on the life of Carl Jung, Carl Gustav Jung. It was called A Matter of Heart. I went into the Lemley. It was 2 o'clock in an afternoon on a Saturday, and it changed my life. I saw this film and I thought, this is where I need to be. I didn't even have the sort of the intellectual knowing. My whole being knew this is a path I needed to explore. And so I went up to the Q&A person, James Kirsch, Dr. James Kirsch, who was offering a Q&A, and I said to him, and I was 26 at the time, I said, I want to go into analysis with you. I want to understand more of the human psyche. And he was 91 at the time. And he said to me, I will work with you until I'm not here anymore, basically. And
Wow.
he said, I'll take it. I said, I'll work with you until you pass on. And he said, okay, let's start next week. So I started analysis with him and started exploring my dreams. It was a lot of dream unconscious work. And it just opened up a world for me. I started to understand the concept of the unconscious. I started to read. I got back into grad school. I did my master's and then I went on to get my PhD. And everything led to this path, which the doors kept opening. I got into my internships, and they were fascinating. Fascinating. My first ever patient had schizophrenia, so I had to learn very quickly, about different voices, and I was put in a room, and they said, "Here's your first patient," and I remember her to this day, and it was a real like trial by fire. Here I am, somebody with different multiple personalities. And I was fascinated. And so the trajectory of PTSD sort of unfolded for me in terms of understanding how complex trauma is and how misunderstood it is. And that was the thing that I'm really realizing, is how diagnoses are assigned to people incorrectly, as far as I'm concerned,
Mhm.
when they're not looking at the underlying trauma that they're actually experiencing.
Yeah.
People are called ADHD, people are called so-called bipolar. I'm not minimizing in any way the importance of maybe giving a category, but I don't think that the trauma that underlies these so-called diagnoses is looked at nearly closely enough in terms of how the family system has impacted the diagnosis and also solutions and also therapeutic treatments for trauma, which I think we have a long way to go in terms of understanding.
Yeah.
So a little piece in a nutshell.
No, something that I love particularly about your story is your zest for understanding.
Mm,
And that had come so young for you. Your interests, hearing about your father, hearing about, the environment that you grew up in and wanting to understand that as a small person. And, how does this work? How do we cope? How do we go forward? And, also being on that soul search that you had talked about. You were very young, in LA. And again, that zest to understand more, to know more. And I think, that shines through and certainly in what you do today. The zest is there. It does not go anywhere, you know.
by mental health. I'm fascinated by the human psyche. I'm always learning, which I think is so important for someone who has a career, that they don't sit on their laurels and think, well, I understand. I think that Carl Jung mentioned at some point, that we know nothing. I think he said we know nothing of the human psyche. All we do know is man's capacity at the time, man's
Mhm.
capacity for evil, and that we minimize the lengths that a human being will go
Mhm.
with being unconscious in terms of the evils that can be invoked and also offloaded onto humankind. And we've seen that in wars, and we've seen that in behind closed doors in families. And so there's so much cumulative trauma that goes because people inadvertently, unintentionally are not attuned to their children. And they
Mhm.
focus on achievement and they don't focus on relational connection. And they don't focus on the importance of holding a space for emotions and being able to let a child express their feelings without trying to rid them of it. Because riddance is something that really is typical in family systems. Oh, don't cry, or you'll be okay. But you really need to hold a space for a child to say, that makes sense that that's
Yeah.
upsetting. You know,
Yeah, validate them, listen to them, and a lot of what you have talked about is definitely trauma focused. But is there other common areas that you find today in your practice that you are focusing on, that you are commonly treating people with or listening to them? What do you find that people are just truly struggling with today?
trauma.
Trauma.
You see, that's the thing. Dr. Robert Stollerow is my mentor. He's in his 80s. I've been working with him. We've been working together for 10 years. I
Mhm.
don't give up having a mentor because he stretches me. I haven't had a session with him. We speak, each month where I haven't learned something new. And he kind of marked X marks the spot very importantly with a book called Trauma and Human Existence. And I think when people hear the word trauma, they go, oh, that's something that doesn't belong to me. It's something that is somebody who's been in war, who has had an extreme, experience. But his position, and I agree with him, is it's traumatic to be on this planet. It's
Mhm.
traumatic if you really think about it. We're hurtling out in space. We're going at some ridiculous speed. We are the only little blue planet in a galaxy where there's 2 trillion galaxies, because I like Brian Cox and I like the way he talks about astrophysics. So we're here, and it's like, well, what are we doing here? But the most important thing in terms of what are we doing here is how we relate with one another, how we relate with one with human kindness, with insight into this is an extraordinary, unusual situation we're in here.
Mhm.
But when I use the word trauma, I'm not talking about, oh, you've just been on the front lines of a robbery or you've come from war. You our human existence is who are you? And, where are you in the world and what is your purpose and how do you want to be related with and treated with? And I think people are cavalier about that. I think people don't realize that human kindness and that dwelling and that holding and understanding with empathy is a foundational piece that we really need to extend to one another in
Yeah.
terms of being able to be grounded and to recognize the uniqueness of each individual person. Without that, trauma, and people say big T, little t, I'm not interested in that. It's like that's, it's traumatic if you don't have that insight into being able to understand our fundamental human existence. And that can grow unknowingly, like a fuse that's being set. You have a child in a family who's being misattuned to emotionally, whose focus is on grades, whose focus is on going to classes, whose emotional world is being misunderstood. That over time becomes what I would call and is called cumulative trauma, where you're gathering this sense of emotionally being annihilated unintentionally by a parent who
Mhm.
wants the best for their child, but unintentionally not balancing it with emotional awareness.
Yep.
Balance, if it's out of balance because the psyche is seeking balance all the time, becomes traumatic. So that's how I'm using the word trauma, that it's not about an event, it's about an experience that can grow in the shadows, if you know what I mean.
Yeah, no, that makes a lot of sense. I think often we come up with ideas of what things are to us. And, I really like that way of thinking because, I think oftentimes we complicate a lot of things, right? And things are actually pretty simple when it comes down to it. And so I really like that. It is more of a universal thought. It is, it's something that is very simple. It doesn't mean you, like you said, you've come back from war or you have been involved in a robbery and something that you would maybe typically associate trauma with, but it can be something just as very simple as you said, is it existing on this earth. And there,
The piece that's important is that the trauma can be averted when there's a relational home. And that's a phrase that Robert Stollerow coined. A relational home meaning that trauma doesn't have to be a trauma if you know when you've experienced something. Like, for example, I've been dealing this morning with my daughter in Nashville, whose dog is having to be put down today, unexpectedly diagnosed with an unexpected disease. And it's been very traumatic this morning. However, what in our conversations, holding those emotions, validating those emotions, the impending loss that's going to happen today, talking about the beauty of that beautiful dog and how we're going to lose him today. But those conversations can ameliorate
Mhm.
PTSD, can actually reduce the potential for post-traumatic stress because there's a relational home that's being
Mhm.
provided between us where we're giving each other the truth of the impending loss. And
Yep.
therefore, trauma can be reduced and even, significantly eliminated when these kinds of empathic conversations can take place.
100%. And something that, kind of stretches on this same path is, kind of like what I said before, a lot of people, we have ideas of what things are in our mind, but you know, people definitely verbalize them and they might ask you, in the day of age of, you can look things up very easily online. You can get things at your fingertips to read online, true, not true, right? What are, I would love for you to blend in, more of those misconceptions, as to, what you're hearing maybe on a daily, weekly basis of what people might think you do, or maybe what is different about your approach. I would just love to hear some of that.
My approach isn't solution focused. There's
Yeah.
a lot of modalities out there today, especially, which is called trauma-focused CBT, cognitive behavioral therapy. I'm not a big proponent of it. I'm not here to diminish it. It
Mhm.
has its place. It's sometimes
Yeah.
important cognitively
Mhm.
have some clarity of what is going on. But there's also what's the term they use? It's not resilience training. It's something like that, something to do with resilience. Um, to me, the irony is the more you can go and talk about loss and grief, the more you can hold that, the more resilient you become. So that's the oxymoron for me. If you avoid holding the emotional space, you will actually become less resilient because the Heidegger said man is steeped in mood. Descartes said, I think, therefore I am. The way in which I'm trained and the trajectory of the way I am in my life is Heidegger's theme, which is man is steeped in emotions, not I think, therefore I am. And Descartes talked about an isolated mind. Heidegger talked about the collective experience.
Mhm.
The isolated mind is, well, I think, and that's the truth.
Mhm.
Therefore, but Stollerow and Heidegger would talk more about collaboratively, you and I talking creates something bigger than you and I. Your input and my input creates what is called sometimes the analytic third, or something more than the two of us. So, in a simplistic term, two heads are better than one.
Mhm.
You know, you and I collaborating together are going to come up with something that's expansive. And I kind of go along with the expansive universe. The more we go into our relational connection, the more we can expand and grow. So that's sort of the premise, rather than you're going to do this alone, and I'm the therapist, and I'm going to show you the direction you need to go in and go out there and do it. I bring the patient into the room with me, and we collaborate together. I'm not so much a guide as I'm in the room with all my trauma, but my awareness of it. My
Mhm.
patient is in the room with all their trauma, and we talk about that. And we know together that we understand trauma. And in that collaboration, we can grow and be more than the sum total of that experience. I
Mhm.
don't know if that's gives you some insight into the way I sort of work.
Yeah, someone had once explained to me, someone, that I feel like is very similar to you. And I love this analogy that they said is, when I work with people, it is us together in the car. They are the driver, and I'm the very helpful passenger. I'm here to help you with directions, feed you a snack if you're hungry, but we're going to get there together. We're going to work and get there
Sometimes
together.
they're not the driver. Yes, sometimes
Yeah.
they're not because they don't know.
Yeah.
Sometimes they give the wheel over to me. Sometimes
Mhm.
I don't know. And in that not knowing, there's a lot of potential.
Mhm.
That's the thing. It's like people feel a lot of shame when it comes to feeling trauma, like somehow they should know better, or
Mm.
they're supposed to have a direction. And so dwelling in the unknown has so much potential for properties of potential growth. When somebody says to me, I don't know what to do, I'm like, okay,
Yeah.
okay, you're somewhere with the I don't know. And I'm in the I don't know with you. So as long as we're together in the I don't know, we've got a chance of, you know, coming up
Yeah.
with whatever it is that does need to be experienced, not known. I'm kind of moving away from the cognitive to the organic, what I would call the aliveness, because when you start to reclaim your feelings, because Donald Winnicott talked about children whose feelings go into cold storage when they're traumatized or they're misattuned to. They shut down their emotions and they accommodate to the parent. Basically, they're focused on the parent to make sure mom's okay, dad's okay. I'll sacrifice myself to make sure they're okay. But when they work and their feelings start to emerge, aliveness happens. They start to come back to life. So that cold storage, when it starts to get warmed up, Now you're feeling aliveness is not such a cognitive experience as much as a being experience, a physiological, emotional, holistic aliveness.
Yeah, I love how much. You know, people often tell me in this position, what they do, how they do it, but there is a certain depth here in terms of understanding potential and you talk a lot about, early childhood trauma that manifests into its own monster, I think, as we grow, not being able to heal on it, always being future focused and not talking enough about that healing portion. I think that gets skipped.
If I do something, what do I have to do? There's a lot of doing focused, which, if you look at it in a stereotypical way, and a lot of therapists, I don't think they realize, they say, well, get into, well, what do you think can be done? It's got a certain masculine emphasis on it because the doing is sort of solution focused, but it's also action oriented. And I think in trauma, it's more, well, how are you feeling? How are you being? And if the being and the feeling is acknowledged, the doing organically comes. But if you put the cart before the horse and you ignore the big pool of all of those feelings that need to be expressed, then you're putting the cart before the horse and you're actually setting up potential for failure because that backlash will come because those feelings have still not been acknowledged. And the meaning that is made of the feelings. Kohut talked about, Heinz Kohut, who was post-Freud, talked about empathic attunement and holding an empathic space. And he worked with the narcissistic community, call it what you will. That was his focus of priority, was working with narcissists. And he made a lot of progress with empathic attunement. Stollerow was a friend of Kohut's and said, empathic attunement is very important, but the meaning you're making of those experiences is probably even more important. And he called them organizing principles. If you are attuned to, but the meaning you're making of your experience is there's something about me that's unacceptable because I couldn't overcome that trauma. The organizing principle is the piece that's even more dangerous. You have to get in there and say, where do you get the idea that because you've experienced trauma, there's something flawed about you? And that is the piece where people go, well, let's find a solution because you shouldn't be experiencing trauma like this.
Mhm.
And that's the misinterpretation that can get overlooked. So the meaning you're making, no, trauma is a human experience. It's
Mhm.
not about shame or you should overcome it or there's something wrong or flawed about you. Every single person on the planet, to greater or lesser degrees, has experienced it. And in reducing that shame,
Mhm.
we can now connect with one another without this shame coming in, like there's something flawed with you because I haven't experienced trauma.
Mhm.
I'm fine. No, everybody has, and it's okay. And it's
I Yeah, I completely understand that. And it makes a ton of sense, and something that I'd love to ask you, and this is amazing. Everything that you've been saying is not anywhere where I thought this interview would go. But I love this. I
either.
I am I'm amazed, I'm surprised. And I'd love to dive into this question of, based on the work that you have done with everyone that you have seen that has experienced trauma, which is all of us, right? We've now established that, right? Would love to know, right? We're all in the same boat here. Um,
Yes,
we are. And
I believe that. Yes.
yeah, and I'd love to,
Relief. What a relief.
yes, I agree. And I'd love to know, what maybe advice that you would give. And this is kind of an interesting two-pronged question. One from the patient side of thing, but also one from another clinician standpoint would be, what advice would you give to someone that has experienced trauma, to, what homework or something to take, someone that is listening to here can take with them and to better, maybe to better understand it, to seek within, or but also on the clinical side of it, what would you love for clinicians to understand and to implement into their own practices regarding trauma?
I often, and I'm a supervisor, so I supervise quite a lot of interns. The model that I supervise is called intersubjectivity, and that was a theory that was introduced by Stollerow and George Atwood, and there are other theorists who are sort of aligned with that, Bernard Branshaft, Donna Orange. But the piece about trauma that I think when I listen to the supervisees when they first come in, and they know me well enough know that I stop them almost immediately because a patient will come in with a presenting issue, and the first thing they do is empathically inquire more about it cognitively. And the first thing I'd say is, okay, I can stop you. That's a good question, but you want to reflect back an emotional state first of all. So if
Mhm.
somebody comes in and says, I don't, my parents are getting a divorce and I didn't, I'm just, and there's statement of fact. Facts are not feelings. I know that. So the first thing you want to reflect back is a feeling state, which is I'm wondering how devastated you feel. I'm wondering how sad you feel. And you're immediately going to the mood state so that you let that person know right away that you're aligned with understanding the complexity of emotions. And then you can inquire, what more can you tell me about this in an empathic way? But the mood state is something that needs to be infused more from the therapeutic community, I think, before you're asking cognitive questions. So you're going back and forth with a balance between holding and the when somebody says, I understand how you feel, it's amazing how the body relaxes. The nervous system starts to relax. Because why? Because you're no longer isolated. You have a breathing, living entity in the room that actually understands how you feel, and your body, literally, your nervous system can kind of trust that you're not isolated with these difficult feelings. So that would be one thing that I would prioritize in terms of back and forth, not just intellectually asking questions, empathically, which is important, but also naming the emotions and asking, does that emotion feel right for you? Is that right for you? And to recognize that there's no one size fits all, that people are complex and that people have had unique experiences in life and that their experience is unique to the contextual experience of their family system. And no two people are the same. You can't take a modality and apply it across the board. You have to see each person as a unique individual with their own unique experience.
100%. I love that. And I really appreciate you. One, I think it's important for all of us that are listening that, maybe not have their own practice. It's important to understand what we can do, and in our own understanding. But clinically, it's really great to see, you have obviously have done so incredible. You have opened up, so many more locations and have a thriving practice. And I think it's really great for other clinicians to know how to grow, things that they should be considering, do their own research. And so that's why we do this. This is why we interview everyone week after week because everyone a new perspective, right?
It's great. It's great. Yes, absolutely. I really think that there should be more of an emphasis on understanding how shame and pain and isolation are close cousins because
Mm.
people feel a lot of shame when how many people will cry and say, I'm sorry, I'm sorry, I shouldn't be crying. It's like, my daughter wrote a piece once. She went to CalArts up in San Francisco and she wrote a piece on not afraid to cry in public. And it moved me to tears just to read just that line, because people apologize for their tears. And this is, I think, where we really do need to come together. It's about holding the space of the wildfire stories that are going on in LA here, just listening. I was a beautiful boy. He was like 14 or 15. He lost his home and lost everything. And I listened to him. And before he lost his home, he took a table down to Santa Monica on the seafront there on a chair on the weekends, a 15-year-old boy, and just put a card up on the table, said, "I'm here to listen." And he just sat in the mornings on a Saturday, boy, and I'm here to listen. And it was amazing how many people would go and pull up a chair. Kids more his own age, particularly, came up to the table, and he would just be there and hold that space, and no judgment, just whatever's going on. We need a lot of that. It's like when you said to me this morning, "How are you doing?" I thought I could say I'm fine, but
Mm.
actually my daughter's putting her dog down today, and I'm actually dealing with that. And so I thought I'd let you know, no, I'm not doing so great today, and I don't need you to do anything. I just needed to let you know I'm suffering a bit this morning,
Yeah.
Okay, you know.
I'm with you. And that, with everything going out in LA, it is heartwarming and also so sad to hear, you know, what everyone has been going through. It's heartwarming in the fact just hearing that story about that 15-year-old boy. Um, and I've seen similar stories of people just being there for one another. So I really thank you for sharing that. It's such an important story and things to share, to just be there for one another. I think that's a,
And I think that's what you were asking me. What is there, the being. I think I'm underscoring the importance of the being state of our humanity.
mhm,
As much as the doing, which of course is important, but I think it's gotten out of balance. It's very much gotten out of balance. The being without shame, the being to say, how am I feeling without shame? Like I need to, move along. There's a diagnosis right there in the DSM right now, which I've been writing a paper refuting it because it's called prolonged grief disorder, and it makes me mad because grief goes on a lifetime, and that's okay. Now, that's another story and another, conversation with people who have written that diagnosis in the manual. But I don't think there's anything completely unusual or shaming about, grieving someone for a lifetime. Obviously, if it's completely debilitating you and you're like Miss Havisham, and in Great Expectations with a wedding dress on for the rest of her life, sitting in a window, that's a bit of a problem. I understand that. There's an aspect of grief which should be permitted through the lifetime, and balance. I mean, I guess I'm sort of a big promoter of balance is the thing.
I think that is so true. And yeah, I completely understand your perspective in that. I mean, yes, there should be a portion where grieving is there. It is. It's not what if, it is in your life. There is parts of it, like you said, if that could be maybe a little bit out of control and you can understand that, but there is a portion where grieving is just fine. It's there. It's like
Normal.
I am here. You know, it's the same thing. But one thing where I'd love to leave off today, you've given us so much great information to consider. Um, I'd love for you if you could tell everyone, how they can reach out, whether that be your website, social media, if you have groups, if you have books. I mean, you are amazing, Dr. Katrina Wood. So you tell me all that you have to offer.
That's good. I love that you're doing this. It's you're on the leading growing edge of reaching out in all these various ways and gathering. And you're curious and you're on an adventure too, which I love. I love that. Just in terms of my piece, well, I have a blog, drkatrinawood.com, or it's called healingpsych.com, on Amazon and Barnes and Nobles. I wrote a book which I haven't promoted it very much actually, but I really like it, called Love is the Answer. But my book that's sort of selling and seems to be of interest to people is called That's Not What I Said. And I think I mentioned to you, I got that from my husband when in the early days of our marriage, and I've been married 35 years now, and I have 4 children and a wonderful Rottweiler called Dickens, who's a nutcase. But the book is called That's Not What I Said, because in the early days, when we were trying to establish our relationship, I would say something and I'd question him and he'd say, that's not what I said. And together we said, you really should write a book, somehow about how miscommunication can so easily derail a relationship. And once again, and I want to underscore this, when my husband would say to me something and he'd say, that's not what I said, the piece that was harmful in that was the meaning I made of what he said. So I would hear something, I would have a reaction, and vice versa. But the meaning, the underlying meaning was, well, I don't matter to you, or you don't care. The meaning that was going on was the thing that we had to dig up and say, well, are you saying, that I don't matter? And at the time, our couples therapist, back in the day, we did premarital couples therapy, which actually I recommend. She said, remember the love. Remember the baseline of the love. No matter, even when you misunderstand each other, neither of you are saying you don't matter.
Mhm.
Keep that river of the flow of the love there, and then try and understand what is trying to be communicated with the foundation of love at the base. And
Mhm.
I think that got us through. That we didn't go into the depth of I don't matter as much as I matter, but I'm misreading you right now. So that book, That's Not What I Said, is one of the ones that seems to have some interest from people.
That is amazing. We so appreciate you coming on today. It's amazing everything that you have built from your practice to your books and, everything that you've detailed here today has been nothing short of insightful. So I just wanted to give you a big, very big thank you, for all that you have shared with us.
Likewise to you, and thank you for reaching out and finding me. I mean, it's great, and I love this field, and I encourage people to recognize that going into therapy, and I think I mentioned this, is important for everybody. No shame. There's nothing wrong with you because you're going into therapy. We need more psychology in order to keep us connected, to evolve, and to grow as human beings. The most normal thing is breathing fresh air. Seeing a therapist is perfectly fine.
I
So thank
so,
you.
yes, and I so appreciate you, and we hope to have you on again for more.
As and when. Take care. Thank
Take
you.
care.